You are listening to the Aging Starts Now podcast, where it's all about responding with confidence to the legal, financial, and personal challenges created by a disability, unexpected illness, or aging in general. Join us weekly as elder law attorneys Barbara McGinnis and Chris Johnson, along with other members of the Johnson McGinnis Elder Care Law and Estate Planning team, talk about the tools, techniques, strategies, and services that will make the elder care journey easier for everyone involved. Get ready, because aging starts now.
Do you or someone you know need wound care? Did you know you can do this from the comfort of your home? I'm Elder Care Coordinator Deborah King, a licensed clinical social worker with Johnson McGinnis Elder Care Law and Estate Planning. And on today's episode of Aging Starts Now, we are speaking with Tara Grimett with Personic Health, all about wound care. Welcome, Tara. Thanks for joining us.
Hi, Deborah. Thank you for having me.
So, I assume wound care is more than just a bandage, but what kind of wound care? Who needs wound care? What do we need to know about this?
Yeah, so anyone who has a wound that maybe isn't healing properly may need more advanced wound care. This can include patients with diabetic ulcers, pressure injuries, surgical wounds that maybe is more, that's maybe not healing greater than 30 days, that are not closing, vascular wounds, or wounds related to chronic illnesses. So essentially any wound that isn't improved in a couple of weeks or is maybe getting worse, it's time to consider specialized wound care such as Personic Health.
Okay. And this can be done in the home?
Yes. So we
do we need a doctor to do orders, or how do we, what do we need to do? I have a wound on my foot and it's not getting any better. So does home health call you? Does the doctor call you?
Yeah, so actually anybody can make a self-referral. We do work closely with home health providers, and they can refer. Your practitioner, your primary care doctor can make a referral. Hospitals can make a referral. But again, we don't actually need a doctor's order to make that referral. Our practitioners are nurse practitioners as well as doctors. So they will essentially do an assessment of the wound when they see the patient, and will make the new recommendations and the orders themselves to take care of the wound.
Oh, that's great. And so I presume the wound care involved, so you're assessing where the wound is and what kind of care it needs, probably more than bandaging. Do you use special equipment for wound care? Like I've heard about wound vacs and
absolutely. So there's a variety of things. We do skin grafting, we do debridements, we do wound vacs. So the criteria is a stage 2 or greater, and it must be an open wound. Those are the only qualifications that must be met. So it doesn't have to be the big, nasty, ugly looking wounds. But in order to qualify as stage 2 or greater, and it must be open. But we do also what is called an ultra mist. It's about a $30,000 machine that we do bring into the patient's home. It's a form of debridement that is less invasive than the sharps debridement. So it works a little bit more for burns. That's less painful and less invasive.
That sounds amazing. So that's one of the things that sets your company apart from other wound care specialists.
Yes.
it sounds like the fact that you have the nurse practitioners that are doing the assessments, are they the ones that see the wound every time, or are there other types of staff, RNs and nurses, that are also taking care? And how often do they come into the home?
Yeah, so similar to a home health practice, we have both RNs and nurse practitioners as well as doctors. Anything pertaining to the wound as far as the assessment and the actual wound culture. So each wound will actually on assessment get cultured. When we come in, we actually own the wound. We will take full possession of treating and healing the wound. That's another thing that's going to set us apart. We want to culture the wound because if it needs antibiotics, we want to get those antibiotics on board as well so we can start that healing process. The RNs that come into play will do the ultramist therapy. That's the only part of the piece that the RNs can do is just that ultramist therapy. The rest of the pieces are for the nurse practitioners and the doctors to do. So the culturing, the actual debridements, the actual wound care dressings, anything of that nature is actually performed by the nurse practitioners and the doctors. So we are mostly staffed with nurse practitioners and doctors only. Otherwise, I will also say that our company was started by 3 doctors. They started this company back in 2019 during the heart of COVID. They noticed that there were many patients who were dying due to lack of wound care. And they were not able to get access to the wound care centers. They were becoming septic and they were dying. So the 3 doctors that started this company decided that there needed to be a change. So they started Personic Health in an effort to create change and create awareness for patients to get access to wound care. And it just slowly started to grow organically. To this very day, all 3 doctors still go out and perform their own wound care and treatment of patients. They're out in the field just as the same nurse practitioners and doctors are to this day. So if they're seeing patients, then they know what the newest and greatest wound care treatment is, just as the nurse practitioners and doctors are on our staff. And I think that's important to know because that's another important factor that sets us apart is it's not just an entrepreneur that started this company that's just trying to make a dollar. This is truly a company that wants to see success for patients and really does put the patient first.
That's fabulous. That's really an interesting story and a great concept to hear. We do have listeners all over the country, although we're in the Nashville metro area. Is this care just local to the Nashville metro area, or are there programs all over the country, and where might they be?
We are in, I believe, 11 states.
Okay.
I believe it's 11 states. I can't be for certain because I'm only in Tennessee, but I do know that we just now progressed. We're opening our next growth spot is going to be in Miami. So we're super excited about moving into that area. But I know we're in Kentucky, Alabama, but we are, if you look up our website, we are in different areas, and we travel out to different areas in the country, but we are in 11 states.
While we're here, why don't you give us the way to reach the website?
Yeah, so our website is personichealth.com. So pretty easy, simple to get to. It tells you, it does have some data on there and telling you our statistics. Our statistics for our healing rate has actually increased since the last time it was updated. It has that we are 22% faster than the national healing average. And that has since grown. We are now 25% faster on the national healing average. So that's about an average of 64 days or 50 days compared to the national average of 64 days. So I think that's pretty awesome to say that we can heal a little bit faster than the national average, that we're actually taking care of patients a little bit faster than the national average.
That is phenomenal, because I know, especially we work a lot with the elderly population, and with all their comorbidities and health and nutrition problems, wounds are a big problem and can take longer to heal. So having access to resources that can help heal quicker can help get people back on their feet and up and moving around, right?
Yes, absolutely. And that's another thing. We are an all-encompassing team as well. When I say we own the wound, that also includes if we notice that the wound is, maybe it's a foot ulcer, and maybe we've noticed that we need to get an extender for the wheelchair to elevate the wound and keep pressure off. We'll order the DME equipment. So maybe that patient doesn't have the home health. Maybe they've exhausted home health benefits. So we get called in to own the wound care. We will also we'll get the prescriptions needed. We'll get the DME ordered. So there's other encompassing factors that we're going to take needed to ensure that patient's wound is going to heal properly. And it's all encompassing. We're not just going to focus on just putting some barrier cream or a wound care, a wound dressing. We're going to take all necessary precautions to ensure that wound is healing properly and efficiently.
That all is real interesting. Does insurance cover all of this care, or am I going to pay out of pocket?
No, it is covered. And that's one thing that we do on our own. When we receive a referral, the only thing that we request is the demographics that have insurance information, name, date of birth, and address, so we can verify. And then, of course, the insurance information. We will actually run that insurance information to verify that we are in network, because we don't want the patient to pay out of pocket. That's our first step. If the patient is out of network, we're going to notify that referral source, or we're going to notify the patient. So that way the referral source knows that we couldn't accept that patient, so there's no out-of-pocket expenses, and that they know that they can make a referral maybe to a home health agency or someone else for continuity of care. And then two, we don't want them to pay some outrageous cost. Because maybe home health would be another option that they could go. But if they are in network, then they know that patient has been now under our care. We're going to take care of them. We're going to do whatever we need to do to get them healed and taken care of. We also fax in updates to whoever the referral source was. So if you've sent us a patient, our nurse practitioners are going to continue to follow and send you updates, letting you know how progressed that patient is going, and when that patient gets discharged, so you can know how your patient's doing. But yes, it is. We take most insurances: Medicare, Medicaid, Medicare Advantage plans, commercial insurances. Yes.
Perfect. What area do you cover, at least in the Nashville market?
So we are pretty much all of Middle Tennessee is pretty much covered. And the little rural communities, I always say, send it to us, let us know, and we'll see if we can get coverage out there. But all of Middle Tennessee is covered, and then we are Knoxville, Chattanooga, out in those areas as well.
Memphis.
We are working on Memphis right now. I don't think we have active coverage in Memphis right now. We are more focused on the east side, but I think that is in the near future.
Okay. So what I'm hearing you say is, if I know someone, or there's someone in my family that they have a diabetic wound, they have a surgical wound that's not healing, that they can contact your office through looking on the website or calling your office, and you will get out there and do the you'll check the insurance first and then do the assessment and get care started.
Absolutely.
Pretty quickly, it sounds like.
Pretty quickly, yes. As long as it doesn't require an authorization. Some of those insurances do require a prior authorization and can take up to 2 to 5 business days. But as soon as that prior authorization comes in, we notify the patient and we do what's called an intake. That is a telehealth visit. And we do the telehealth over the phone. And then as soon as that telehealth is completed, we have a nurse practitioner out the very next day.
Wonderful, wonderful. And then the treatment plan, you're going as frequently as the treatment plan requires and taking your machine and whatever they need so that they can get the care. And I guess there's a lot of education that goes along with this as far as how to take care of it in between your visits and how to prevent these types of things from happening.
Absolutely. The nurse practitioners are very well equipped and knowledgeable in their area of expertise. So if there's caregivers involved, they are educating the caregivers and family members on how to take care of the wound in between visits, or helping home health to provide the knowledge and expertise. So it's a comprehensive care team. Just we're all working together to get that wound healed.
That's amazing. I have learned a lot today. Is there anything else our listeners need to know about Personic Health?
Just like I said, making a referral is very simple. You can give us a call. We're always available. We work on weekends 24/7. So anytime there's a need or a question, you can give us a call. We'll come out, we'll look at it and determine if it qualifies. I always say, when in doubt, just give us a call. And even if it's insurance related, we will do our best to see if we can get it covered. And if not, we'll find you some help and make sure that you're not out there alone trying to figure it out.
Well, thank you, Tara. Wounds are not something we like to talk about, but the information has been very helpful. And if you need help, you can contact Personic Health and get the information and get an evaluation started.
Absolutely.
That's all the time we have for today. Thanks for joining us on this episode of Aging Starts Now. If you know someone who could benefit from this conversation, we encourage you to share it with them. Johnson McGinnis Elder Care Law and Estate Planning is a life care planning law firm dedicated to helping individuals and families navigate the complex care, legal, and financial challenges that come with aging and disability. Be sure to tune in next week for another episode of Aging Starts Now.
Thank you for listening to the Aging Starts Now podcast. For more information about today's show, visit tn-elderlaw.com, click on the Free Resources tab, and then click on Aging Starts Now. You'll find the show notes there. And while you're at it, why not check out all the free resources available at tn-elderlaw.com. Document downloads, the Johnson McGinnis blog, educational videos, informative articles, helpful links, a TV show, and more. It's all there, free for the taking. If you enjoy listening to the Aging Starts Now podcast, please subscribe, rate the show, or leave us a review. It's easy to do on whatever app you use to listen. We would love your feedback on the show. Aging Starts Now. We'll be back next week with more candid discussions about the challenges created by aging, disability, and unexpected illness.